to our new speaker, and she's an amazing lady. She has been in UCL, which is University College London, and a very dynamic, and you can say, when I spoke to her, and I found her really visionary and very sparkling and vibrant in terms of her thoughts. And she's going to talk about healthcare landscape in Saudi Arabia. And we know there's COVID-19, the spread of infectious diseases. And so she would like to talk about the telehealth, infectious diseases, and welcome wellnessness. So Aliza, yes, how are you doing today? I wish you a good day today, and Mike is with you. Please go ahead and share your thoughts.
Sure. Thank you for having me, Musa. It's a pleasure to be part of this investment conference. So as you introduced the topic quite broadly, I'm going to be speaking on telehealth, about infectious disease and wellness in terms of the Saudi Arabian healthcare landscape. I'll touch on 4 broad subtopics and then extend some detail for people who are specifically interested in investing in these areas. I think I'm going to start by talking about the recent position in relation to foreign investment. Then I'll move on to the opening of doors to foreign investment, talk about telemedicine next, and finally wrap up with the kingdom's commitment to foreign investment. I'm going to skip my introduction because that's widely available on your platforms. And let's rewind back to April 2016, which was a blaze of publicity vision for 2030, and it was announced to the world. It promised to transform the Kingdom of Saudi Arabia and reduce its reliance on oil income for economic growth by channeling energies into other revenue streams. So certain sectors, industries were identified as having the potential for growth, with one area being the healthcare sector. So the goal here was to improve the quality of healthcare services and to promote competition amongst healthcare providers with a move towards the private sector as opposed to the burden falling on the public sector. And ultimately, the public purse. So it was recognized that it was necessary to create an environment that will attract both local and foreign investments by making it more attractive for the right investors in the right space and to invest with their expertise, with their capabilities, their energy and finances in the kingdom. So Vision 2030 also recognizes the need to embrace healthcare information technology, which is, the budding word of the minute, as digital innovations are vital for sharing knowledge among healthcare professionals, as well as improving the performance and the productivity of healthcare providers. Eventually, all medical records will be electronic based. Saudi Arabia is moving slowly, and I would say about 50% of the electronic records are proving to come up with 2030 vision. And with the objective of linking up the Ministry of Health with healthcare providers in order to share the patient information on one systematic database. We're seeing a lot of interest in health information technology from foreign and local companies, especially in the cloud-based diagnostic software, as they're keen to offer their services through an appointed Saudi distributor to healthcare providers and professionals. And this, links in very beautifully with the second aspect of my talk, which is the recent position the kingdom maintains in relation to foreign investment. I think it's quite obvious that until recently, there were limited options for foreign investment in the healthcare sector, as foreigners could only own, operate, invest in large hospitals, and they were unable to invest in other healthcare institutions such as clinics, polyclinics, laboratories, as well as healthcare support service centers, be it physiotherapy, nutrition, or optical centers. Furthermore, pharmaceuticals and medical devices not manufactured in KSA could only be distributed and sold in the kingdom through one specific appointed and registered Saudi-owned distributor. So the opportunities for foreign investment were slim, even though the manufacture of pharmaceuticals and medical devices have been actively encouraged, and the ownership of hospitals has become an option for investors since 2015 now. So many manufacturers still choose to distribute their products through distributors. And to date, the uptake by foreign countries and to own and operate hospitals has been slight, as the Saudi Arabian General Investment Authority, the SAGIA as I call it, was only accepting applications for licenses for larger scale hospitals until earlier this year. So I believe there is no plan to allow foreign companies to directly sell and distribute pharmaceuticals and medical devices in the kingdom, and this will remain the preserve of Saudi-owned entities and individuals for various reasons. And now moving on to how we could potentially open the doors to foreign investment and, attracting both European companies as well as Australian companies who have expressed interest in launching their operations here. In roughly March 2019, last day, it was announced that foreign companies could own and manage private healthcare institutions and support healthcare services centers in KSA, with the exception of clinics and pharmacies. So I'm specifically referring to Article 2 of the Private Health Institutions Law and Executive Regulations, which is under the Royal Decree. And this was amended to reflect the change, but it is not yet in force, even though it has been approved. However, both the Ministry of Health and the Saudi Investment Authority have implemented the change, and they're accepting applications continuously for operating license and foreign investment licenses. Both authorities have been quite cooperative and encouraging of foreign investment. And the Ministry of Health, my own mother, who's a doctor, tells me, has published a healthcare investor licensing group, which documents all the recent changes to foreign investment in the kingdom's healthcare industry. And it explains in very, very simple terms how the license application process works. So in a nutshell, all healthcare institutions and support healthcare service centers must have a Saudi managing director, and with the exception of hospitals and support healthcare service centers, all healthcare institutions must be supervised by a Saudi physician. Hospitals must have a qualified Saudi medical doctor rather than to be supervised by a Saudi physician. The operating license application process has been improved significantly and is now carried out online. From our experience, the process is relatively straightforward and efficient. The Saudi Investment Authority has no minimum capitalization requirements for healthcare investment, which is welcome news. It's brilliant because initially there used to be a quota. And as previous investment opportunities open to foreign investors required a substantial minimum investment. So I would recommend that all investment vehicles have that minimum capitalization of at least 500,000 Saudi Arabian riyals, as this is the usual minimum requirement expected by the Saudi Investment Authority. And this demonstrates a firm commitment by the foreign investor to commit to investment in that country. Both the Investment Authority in Saudi Arabia and the Ministry of Health have reported a lot of interest in both areas from potential foreign investors, as well as the obligation of local investors to improve their services and their level of commitment. And they're proving to be very willing to assist potential investors. We are currently assisting a number of clients in exploring available options and establishing healthcare institutions and supporting healthcare services centers within the kingdom. I think the move is slow, that some large healthcare providers are watching the Saudi market very closely. And we know, and in our experience, that at least one market leader that is keen to enter the Saudi marketplace, specifically the Genova company. And this brings us to telemedicine, which is, the big word out there, and it's the best potential revenue source for healthcare investors. The Ministry of Health has started offering this license for telemedication and telehealth centers. In conjunction with this, the telemedicine regulations were, after much anticipation, finally published in June of this year amidst the pandemic. And, these discussions around these regulations could be more in detail with the healthcare law update, which is available online. But coming back to telemedicine centers, you need to have a Saudi managing director, and it has to be supervised by a suitably qualified medical professional with no nationality specified in this case. And telemedicine centers allow for the collaboration between medical institutions, both inside and outside Saudi Arabia, to share this knowledge and this experience in order to make more accurate diagnosis. And then telemedicine slowly linked to, infectious disease has expertise outside the kingdom, which will benefit patients and will slowly but surely enable Saudi-based medical practitioners to develop expertise in their chosen field. So I'm assuming, through collaborations and medical institutions in other countries, a number of hospitals within the kingdom already provide a telemedicine facility as an additional service to its patients. This is a growing trend, and we expect to see more examples of this in the future. Healthcare insurance providers, for example, provide for reimbursement of telemedicine fees, which makes investment in this area even more attractive. Telemedicine and teleconsulting is ripe for investment, really, and it will only be a matter of time before foreign investors start recognizing this opportunity. And finally moving on to the last bit, which is how is the kingdom expecting its commitment to foreign investment in the future? So I think with the opening up of foreign investment into healthcare institutions and supporting healthcare service centers this year, it demonstrates the kingdom's seriousness in improving the private healthcare market to benefit citizens. It is actively seeking foreign investment and is welcoming the right investors with open arms. It's paving the way for easy incorporation without administrative delays and complications. We are confident that the healthcare market will change beyond recognition over the next few years with hopefully higher quality, and this high healthcare quality service being available through all traditional mediums and digital platforms. I anticipate that once a change to foreign investment opportunities is widely known, we will see a number of foreign-owned healthcare services providers and even joint ventures with Saudi local partners entering the marketplace throughout the kingdom, providing for a very healthy competition. So while there might be a fragmented market, you have that healthy competition and a heightened service level as an anticipated vision of the 2030 goals that they had. The changes have taken everyone by surprise. And, the UK itself is quite interested. And though longed for what were not anticipated in confidence, and, they've helped change the healthcare landscape. So now the opportunities are endless for the investor with vision, with drive and ambition.
Oh, that's great. I think you have given a lot of insight and in a very squeezed and comprehensive way. Actually, we're working last week. I was sitting with a very qualified robotic surgeon in Britain, and what they're doing is, suppose you are sitting in, say, Saudi Arabia and UAE, anywhere in the world. So they, with the robotic technology sitting in UK, they are doing surgeries, and this is really a great initiative that we can say. And in terms of minimum invasive surgery, means it's a keyhole surgery where you are just putting a keyhole, putting the camera inside the body and operating from New York. Patient is somewhere in, say, Dubai. Yeah. So this is a great revolutionary innovation, and it is the future of the world, actually, because we don't need to travel to United States anymore. We can invest in Saudi Arabia, we can make the setup, and we can keep these high-end doctors across the globe on our panel, and they are available for our physicians or surgeons. Both can operate in the same way. And you are right that, and luckily in this show, we are going to have some speakers who have already invested in healthcare in Saudi Arabia, like Saudi German Hospital. In this show, we are going to take them and share their thoughts and experiences in Saudi Arabia. So with this telehealth and infectious diseases, it's a comprehensive discussion, of course, and there's a lot of things to learn. But because you are a very dynamic professional, and somehow you are connected with Saudi Arabia as well. So I just want to take a feel and look for the external audience who are listening to you, that what are the opportunities for women? You as living in Saudi Arabia, you studied in UK, you're still there. So tell me, some positive vibes which we can give it to the rest of the world.
Sure. I think lots of potential here in Saudi Arabia now, which has become increasingly welcoming of the female population participating in all kinds of professional tasks, really. So, whether it's the primary industry, secondary, tertiary, and, healthcare is increasingly being recognized part of the service industry. And you can see every kind of specialist is a female, and they're leading a number of clinics and surgeries across the kingdom, both for the royal family specifically and for the general public. I think if you're looking to build a career in Saudi Arabia, you do need to be mindful of the requirements here, which are quite strict, as for any country really, because the medical profession is one that's quite important, and there's a lot at stake. But besides those, I think you have plenty of opportunities to work for both the government as well as the private hospitals. If you're looking into building a future long-term or short-term, you can, look into factors like the demographic profile. You can look into the government initiatives and policies. There are specifically recruitment schemes for clinicians and pediatricians. Also look at the tech that's being developed and to what extent, your own job, your own specialty is going to change over time. I mentioned some of the healthcare companies that will be investing in the Middle East, for example, Diginova and Telehealth, and they're looking at enabling digital solutions, which is, a place where you could get involved. It doesn't have to be someone who's widely experienced. There are an increasing number of starting level positions. And, there's a global trend clearly of female involvement as well as success rates in surgeries. Lots of research by the Lancet. And I think, it's key to challenging the healthcare system and reviving the way that we can actually implement those solutions.
That's amazing. I think I wish you, it's a very insightful, and I'm really thankful for you to join this show. And I'm hopeful that in the upcoming events, we will keep you on the board and you will share your insights.